Hi everyone, welcome to my channel. I'm Sonia and today we're talking about lupus, what it is, what's the cause, and of course the treatment. In the Middle Ages, the term lupus was used to describe a necrotizing ulcerative skin condition. It was often thought to be from the bite of a wolf. Superstitious people at that time related these skin conditions that were often very visible on the face to the bite of a werewolf, given the grotesque features that were often visible. The cause of lupus remains unknown and our treatment options are still limited, and it has been described as affecting many people over the last 100 years, and it affects people worldwide. So there's estimated in America something like 80 million people suffer from lupus. So if you like health information that is research-based and valid and current, then you need to subscribe below. The normal role of your body's immune function or immune response is to attack any cells that are strange or that your body needs a defense mechanism mounted against, like a bug or a viral or bacteria. However, in autoimmune disease such as lupus, the body's defense mechanism gets skewed, and instead of attacking infection, it actually attacks your body. So it is attacking your own body. And this is not a good thing. And there's lots of diseases that actually do that, and these are called autoimmune diseases. For some people in lupus, it just affects the skin and maybe the joints. For others, it can affect things like your lungs, all your organs in your body. So your lungs, your kidneys, your blood vessels, your brain, and other parts of your body may also be affected. So what are the symptoms? Well, the first symptoms usually occur between the ages of teen years and 30. So hopefully, if you haven't got it by then, you're not going to get it, but that's just a rough estimate, okay? So the condition can start out mild, moderate, or severe, and it can be sporadic. And so you can have it sometimes, and then it goes away, and then it can flare up again. So general common symptoms are things like fatigue, fever, hair loss. Lupus can also affect individual organs, as mentioned previously. So pain is experienced usually in the areas that affects the different organs. So for some people, it could be when they take a deep breath, and this could mean that your lungs have been affected, or it could be your whole body. You could have anemia, fatigue, fever. It could be your skin. You could have a red rash or scaly rashes, or it could be your mouth. You can have dry mouth as well as ulcers. The telltale sign of lupus is often the feature of a butterfly rash that comes up over this part of your face and often on your chest here as well. I'll put a little picture here. So the butterfly rash is a classic giveaway really for having lupus, and doctors look for that. But of course, all these other things that you can describe and actually experience are all part of the symptoms of having lupus. So what is the treatment? Are there any treatments? Well, there is no cure for lupus. Current treatments actually are there to help reduce the flare-ups, improve quality of life through actually mitigating those flare-ups and controlling your symptoms. And it begins with things like lifestyle modifications. Now, I know you love it when I say lifestyle modifications, because you go, oh no, what will I have to do? If you want to stay healthy, then there are things that you just have to do that keep you healthy. And these are things like stop smoking, lose weight. In lupus, lupus actually affects your lungs. Why would you smoke? Smoking affects your lungs. We know that. So if you have lupus, quit smoking. If you are overweight, you need to lose weight because lupus can affect your heart and your blood vessels. And we know that when your heart and blood vessels are affected, you're at more risk of heart attacks or cardiovascular disease. And, people as young as 20s who have lupus are having things like heart attacks. So definitely losing weight so that your BMI or that you are in a healthy weight range. Other things that you can do, of course, is to eat a heart-healthy diet. So this could be things like, and this is again because of the cardiovascular risk, so it means cutting out things like red meat. Red meat is not your friend. Sorry. Eating cows or lambs or porky pigs is not your friend when you have lupus. It's not friendly to your heart. Stop eating red meat or minimise it and replace it with things that are really good in omega-3s. So things like nice salmon and tuna. These are high in those omega-3s and help protect your heart. And things like, if you don't eat meat, I guess, things like chia seeds and flax seeds are also high in omega-3 and help protect against things like heart disease and stroke. So definitely minimising red meat consumption and reducing salt intake, another thing that can cause high blood pressure. So reduce salt intake, and some people say, and of course then to increase your calcium-rich foods, so your nice green leafy vegetables, because a treatment of lupus is often cortisone, and cortisone can deplete the calcium in your bones and cause osteoporosis. So a calcium-rich diet is very important. And also some people find that things like alfalfa and garlic actually cause flare-ups because there's in their lupus. So if you're one of those, something to be mindful of. Apparently there's some enzymes that when the garlic and alfalfa are broken down, it releases a specific enzyme, and this can cause the flare-up in your lupus. So keeping away from those types of foods might be a good thing. So, and of course, when we're talking about lifestyle modifications, of course, a gentle exercise so that we're maintaining muscles and, increasing bone growth as well, also prevents osteoporosis and muscle wasting as well. So just low impact exercise actually helps with all those things too. Other disease management ideas or treatment are things like anti-inflammatories that help reduce inflammation, steroids, which also help reduce inflammation, immunosuppressive drugs, monoclonal antibodies, antimalarials, and anticoagulants. Because with the lupus, you have an increased risk of blood clots. Now, this is important if you're going for surgery. It's important anytime, but if you're going for surgery, you definitely need to tell your surgeon and your anaesthetist that you have lupus, and they will make sure that they put in place precautions for you when you're having surgery, post-op, and all those things in regards to blood clot formation. In general, steroids are effective, but like all drugs, they sometimes cause side effects, and this can cause things like weight gain. So often when you see people on steroids, especially high doses of steroids, you'll notice that they have a moon face. That is a direct result of steroids. It causes fluid retention and swelling. It can cause acne. It can cause irritability. It can cause poor sleep. It can cause infections. It can cause osteoporosis. So cortisone as a treatment for lupus can help reduce it and decrease the redness and inflammation, but it also has other effects that affect the person as well. So, definitely when you're on cortisone and it's working, that's a great thing. And once it's worked, it's not like you can just stop cortisone, because you can't, okay? when you're on cortisone, and people who are on cortisone for different reasons know that once they reach a therapeutic level or once the problem has passed, you just can't stop it. You must decrease your dose slowly to wean yourself off it. It's not I'll stop that now, I'm feeling fine. You can't do that. Okay, so you must listen to your body and your doctor and their advice as well. So there are some of the drugs that actually, help with lupus. The other things that are a problem is, sometimes they say like 50% of those with lupus have kidney damage can have kidney damage. And if this kidney damage is quite severe, they may end up requiring something like a kidney transplant. So if it becomes enough, the kidney becomes scarred, they start to lose renal function and will need a kidney transplant. And a person that's in the public that has actually done this most recently is Selena Gomez. She's actually had a kidney transplant, and another person also who has lupus is Seal. And we know Seal because, he's big, we've seen him on The Voice or whatever, and he's a well-recognised man. And we know that he has facial scarring because it's very visible on his face, and that is a direct result of lupus, scars from his lupus on his skin. So the heart can also be affected, so increased heart attacks. So that's why you need to eat well, minimise meat, reduce your salt, exercise, be in a good health, okay? Your blood, people with lupus can have anemia, they can have blood clots, there are increased risks of miscarriage. Blood clots can occur anywhere, whether it's lungs, legs or brain, and that's definitely not where you want your blood clots to lodge. So sometimes people are on anticoagulants for that. If there's inflammation, if the brain's affected and there's inflammation in your brain, it can lead to things like headaches. People describe it as brain fog, just not being able to think clearly, poor concentration. They can have seizures as well. So lupus can affect a lot of systems, including your lungs. Patients or people get inflammation in their lungs, and it's called pleuritis, and it causes sharp chest pains. If they take a nice deep breath, they get like this bit of a rub, and it's not comfortable at all. In our joints, it can affect our joints and cause something like lupus arthritis. It's predominantly in the hands. People find that it's in their hands, and it doesn't cause disfigurement like other arthritises that affect joints. So it definitely makes them sore, but doesn't cause disfigurement, unlike many other forms of inflammatory arthritis. It also can affect the digestive system, and it can hit organs like the pancreas and liver and cause the gut to leak protein. And so this can give you another syndrome and definitely can give you diarrhea. So lupus doesn't sound a very nice disease, does it? And it's not. Definitely, the symptoms that I've described of, how it can affect different organs in your body, this can be contained and prevent flare-ups and be managed, then, they say that like 80 to 90% of people with lupus can live a normal lifespan. So this is the good news, that by having or changing lifestyle measures, you can improve your health, decrease flare-ups, and, if you do have flare-ups, have medication that can help reduce that quickly and promptly to prevent damage to that area. So if you have lupus and it's affecting one particular organ, say like your joints, and you get the arthritis, then you'll need to see a rheumatologist. Go see a specialist specific to that particular area. If it's your brain and you get lots of headaches and things like that, go see a neurologist. That's the area that they deal in. So be specific about your treatment. Speak to the best people that you can to help manage the symptoms and the disease process. And remember that 80 to 90% of people with lupus live a very good life, and it's all about managing and mitigating those symptoms. I hope you've learned something new. I ask you to subscribe to my channel, press the like if you liked what you heard, and definitely I'll see you next time. Bye for now.